The first one is, can loops help in avoiding forward bending, or you need microscope only?
Um, Actually, there is a basic difference between the loop and the microscope. So that is the confocal light. So if the microscope has a confocal light, that is the light uh, and the objective lens are in the same line. So in loops, most of the time there is some amount of uh, what do you call angulation of the line of vision and the light. So they are not exactly confocal. This is one shortcoming with the loops. The second thing is, now I think few loops have come which have longer like working distance, like 380 millimeters or 400 millimeters. So I think it may work, though I have not tried them. But there is a basic difference, like in loops invariably some amount of eye straining happens, as because like the image is very like the focusing is very constricted, so some amount of eye straining do happens in loops with whatever loop we use. In microscope, eye straining doesn't happen at all. If you just keep on blinking between your cases, you don't have to do anything else, just have to keep on sometime blinking, the most all of the problems solved. As because in microscope we see the image at infinity, always it's always at parallax, so the eye straining, there is no question of converging of the eye and straining. But in loops invariably there will be some amount of convergence, whatever type of loops you use, though few loops comes with that extended working distance, but the straining issue do remain there. So we cannot compare both of them. Loops is for short working general dentistry. Sometimes you have to see quickly, so it is fine, it is handy to like organize a microscope, position a patient, and like parfocaling is a bit time consuming compared to the loops. In such way, for quick short works loops is fine, but for extensive long works microscope is the must thing.
Beautifully explained. Beautifully explained.